Good evening, viewer. Welcome to our Glory Globe TV, your most amazing news. Yeah, a potential future treatment for Alzheimer's disease could involve a nasal spray. Researchers from Università Cattolico and Fondazione Policlinico Universitario e Gemelli IRCCS have identified a way to counterattack cognitive decline and brain damage associated with the disease by targeting the brain enzyme S, that is called the ZDGGS, with a nasal spray drug. The study was led by Professor Claudio Grassi, director of the Neuroscience Department, and Professor Salvatore Fusco in collaboration with the University of Catania. The researchers observed that the post-mortem brains of Alzheimer's patients contained an excess of S transferase, that is called the S-actyl transferase, which could be a promising therapeutic target of new drugs. They also found that higher concentrations of this enzyme were associated with worse cognitive performance. Thanks to a 8,90,000 euro grant from the Ministry of Health 2023 PNRR call, new therapeutic approaches against this enzyme will be explored. The development of Alzheimer's is driven by alteration in certain proteins including beta amyloid and tau, which aggregate and accumulate in the brain. These proteins' functions are regulated by multiple signals and modifications, including the attachment of a fatty acid molecule in a biochemical reaction called S-palmitolation, which is performed by S-actyl transferase enzymes. In previous studies, we demonstrated that altered S-palmitolation of synaptic proteins plays a critical role in cognitive decline induced by metabolic disease like type 2 diabetes. And that brain insulin resistance may impact the amount of active DHHC enzymes in the brain. Professor Fusco explains. The authors also note a well-established link between insulin resistance and neurodegenerative diseases, so much so that Alzheimer's is often called type 3 diabetes. In this new study, we showed that in the early stages of Alzheimer's, molecular changes resembling a scenario of brain insulin resistance cause an increase of ZDHHC7 enzyme levels and alter the S-palmitolation of key proteins involved in cognitive functions and beta amyloid accumulation. Our findings show that in animal models of Alzheimer's disease, both pharmacological and genetic inhibition of protein S-palmitolation can counteract the accumulation of harmful proteins in neurons and delay the onset and progression of cognitive decline. The lead author of the study, Dr. Francisco Natale, adds, furthermore, in post-mortem brain samples from Alzheimer's patients, there are elevated levels of ZDHHC7 and S-palmitoylated proteins too, with an inverse correlation between proteins BACE1S palmitolation levels and cognitive maintenance scores on the mini mental state examination. Behind this exclusive report, Glory Globe TV, Delhi, Bharat.